Okay, I'm Jenny Hilderman, and I'm going to be giving a return demo on giving an intradermal injection on the left forearm of a patient I have been taking care of. It was Mr. Frank F. Fritter in room 208, no known allergies, and birthday of 3/14/50, whom I just received orders for. And what we're going to be injecting intradermally is his mannitol, 0.5 milliliters. And we're going to give that now, and we're going to report any results, any changes in those results in 48 hours to the MD, Dr. Jumpy. And I'm going to go over to my MAR and confirm all of my rights, the right patient, the right medication, the right dosage, and the right route, which is intradermally. And in my system, I have mannitol 0.5 milliliters to be administered now to Mr. Frank Fritter in room 208, birthday 3/14/50. My physician's order and line match up, so I'm going to head to my medroom. Before I get to the medroom, I'm going to demonstrate on my left forearm where you would do the injection site. Now, in a case where you have a tattoo on your patient's arm, you're going to go directly to the side of it, not injecting into the tattoo. So here I am going within the space and just to the side here. Same thing, if your patient didn't have a tattoo on the other arm, you could use that other arm, but since this patient has 2 tattoos, you will go to either side. Do not do injection to a tattoo. Alright, I'm going to head to my bedroom, wash my hands. Again, I'm checking, I'm going to pull my vial out, take the lid off. I'm going to double check. I have mannitol, and I'm going to be administering 0.5 milliliters of this single dose vial. Alright, and it's important to note the time, which is 1800. I'm going to clean the type because in 48 hours we need to report the changes of the signs on this intradermal site. Alright, I'm going to open. I've cleaned the top of my vial. I'm going to take the lid off of my needle. Pull back 0.5 of air. 0.5 of air. Inject my 0.5 into and invert my vial. .5 milliliters. Which I have using the one-hand scoop method. I'm going to recap, clean up my work area, and I'm going to head down to my patient's room.
Hello.
Hi, Frank. I'm here to give you that intradermal injection on your left forearm that we talked about. Do you have any questions for me?
No.
All right, I'm going to wash my hands. Frank, can you give me your full name and birth date?
Frank F. Fritter, 3/14/1950.
And Frank, do you have any allergies?
I don't.
All right, and I'm going to scan your bracelet for my 3rd check at the bedside. I'm going to put on some gloves. After this one, what is? All right, Frank, I'm going to clean the area on your left forearm where I'm going to do the intradermal injection. And Frank, again, in 48 hours, we're going to need to check this. So 2 days from right now. All right, I'm going to double check my 0.5 milliliters. My site's clean and ready. Take off my cap. I am going to go bevel up at a 5 to 15 degree angle. Going to inject just under the skin to create a wheal. Pulling the skin back and injecting and pushing. And as you'll see here, I have a nice wheal, which I am now going to discard of my needle and the sharps, and I'm going to go ahead and mark this area. Alright, Frank, if you have any irritation or any signs you get a hold of us, just call from your call light. Here's your call light. Can I get you anything before I leave you?
Oh, that's great.
I'll be back to check on you. Thank you.
Thank you.
Take off my gloves, leaving my patient comfortable, washing my hands, and heading back to my MAR. I am going to document the date, February 12th at 18:05 for Mr. Frank F. Furter, birthday 3/14/50, that I gave an intradermal injection of 0.5 milliliters of mannitol on his left forearm. Signed, Jennifer J. Hilderman, student nurse, and